Beginning today, young children in New York City no longer need to mask up while attending school or going to daycare.
Masks are now optional for kids up to 5 years old. This change comes after the city's health commissioner revealed COVID-19 cases have fallen 26% in the past 3 weeks. Health officials believe that New York City has surpassed the peak of the latest wave of the virus.
Meanwhile, federal health officials are poised to approve vaccines for children under the age of 5. That could happen on Wednesday. The FDA says that the Pfizer COVID-19 vaccine appears to be safe and effective for children between the ages of 6 months and 4 years of age. The agency posted a similar analysis of the Moderna vaccine for children under the age of 6 last week. Kids ages 5 and younger are the only group, or had been to this point, of Americans not yet eligible to be vaccinated against COVID-19. Joining us now is Dr. Jerry Abraham. He is the director of vaccine programs for Kedren Health in Los Angeles. Doctor, good afternoon. Thank you for being here. If the FDA cleared shots for children under 5 this week, if that does indeed happen, we could start seeing the vaccines rolled out as soon as next week. And despite the upheaval with the COVID-19 restrictions across the U.S. in recent months, what's your message to parents about their kids, vaccinations, the risk factors, all of it?
Yeah, thank you so much for having me again. First and foremost, I just want to say how excited we are that we've come where we are now. You know, June, we've been waiting for these 6 month to 4 year old shots for months now. And so we're literally ready to go. We're ready here at Kedren. I know many vaccination sites are ready to administer 6 month to 4 year old doses as soon as we receive them. So we're really excited to see what's happening at the FDA and soon with the CDC Advisory Committee on Immunization Practices when it comes to the recommendations for 6 month to 4 year olds. As we've been saying throughout the whole pandemic, the right time to get a vaccine is as soon as you are available for it. Sorry, I'm right here in a hospital right now, so apologies for the beeping.
But do you need to drop the interview? If you are needed elsewhere.
No, we're good now. We're good. We were able to get the alarm off. But I will say the right time for a vaccine is always as soon as it is available for you and you are eligible. So we really hope that parents get excited to get their children vaccinated next week if they become available.
So, Dr. Abraham, Tony and I were discussing, because we're both parents of young children for whom all of this is important, New York City dropped its mask requirements for schools and daycare centers for children below the age of 5. Tell us about the science behind masking in kids. And do you think that there are groups that should still be masking? Or are we now just at that individual choice stage?
I think it's very complicated. Here in Los Angeles, we are still wearing masks, specifically on public transportation, within healthcare facilities. Schools, it's been a school-by-school basis decision. So there's no clear right answer. I think there are different guidance in different jurisdictions, and the CDC clearly still recommends them depending on your risk. Those most vulnerable, of course, benefit cancer patients, are aging and ailing individuals. When it comes to the younger folks, of course, it's harder to keep masks on. It's harder to wear masks properly. So I totally understand the concerns, but I do think the best thing to do is to wear masks as much as you can if you are comfortable. And I know that's easier said than done, especially for parents who try to keep masks on or feel very frustrated with trying to make a child wear a mask when they clearly can't or don't want to. Masks play an important role, and that's a part of our strategy as we go from pandemic to endemic. Masks help prevent the spread of contagious illnesses, including infectious diseases like COVID-19. So we do need to use them, especially when we're around those most vulnerable and most susceptible to severe disease and those at highest risk of dying. So mask up, it's okay.
You mentioned the endemic, which is a $10 word for just kind of going around. And this is it. This is the normal. Are we in that new normal right now?
I think for some time we've really been there with pandemic to endemic, a post-pandemic world, and just learning to live smarter with COVID. And that's really why things like masks are still an important part of the tool. But our most important weapon against COVID-19 truly are these COVID-19 vaccines. So we're excited to see the movement that's happening with Novavax and now with these 6-month to 4-year-old vaccines. We still want to make sure that we're isolating and quarantining as appropriate. People still need to test when they've been exposed or when they're symptomatic or concerned they may have COVID. These are all very important parts of this strategy. But I do believe we've entered into this endemic phase where we have COVID fatigue. We're much more comfortable. The disease itself is less severe and less fatal, less deadly, even though many of these Omicron subvariants seem to be more infectious. So we still want to be careful, but we very much so may have moved into an endemic phase. And we may see, as we're seeing numbers increase across the country this summer, may see a wave this summer. Most importantly, we want to be prepared for a fall or winter wave. And so really next generation vaccines will play a very important role as we try to create vaccines that are effective against the Omicron variant. It's really important to remember too, those that test positive for COVID-19 have access to therapeutics like Paxlovid. That's been a game changer. So for a lot of reasons, we're in a very different place than March of 2020. And we really may be stepping out of this pandemic phase and into this endemic phase. And that's really all about learning to live smarter with COVID so we can keep doing the things we're doing, but that really does mean adhering to the guidance from public health.
Well, happy for all of those advances, certainly. Dr. Jerry Abraham, thanks for joining us, and thank you for all that you do.
Thanks, doctor.
Thank you.